I'm strongly opposed to the reduction in health care because on a fixed pension, I just can't survive without health care. I'd probably go into bankruptcy if they don't maintain my health care.
While they may talk about legacy costs, the fact is that when you retire, and he's been retired now for 13 years, is that those costs have diminishing value over the years. And it's wonderful, but it's necessary because now your pension, even Social Security, when you look at your buying power and how much it costs you to do things, they have less and less value. They may look at it as something that is costing them a lot of money, and that's only because there are so many more retirees than there were in the past. But in point of fact, even when you just pay co-pays, for instance, that is now taking up more and more of your available income. So that for them it's a lot of cost, but for the retiree it's still a lot of cost. And it's increasing. I mean, every year come January, I've got to look at our health insurance brochures and see what we've lost. How much less it's covering, what it no longer covers, what the increases now in the copay. And those can be significant. Now, it's wonderful if you have really great health, but none of us is getting any younger, and you have to anticipate that at some point you may start having sizable medical bills, dental bills. It's something about turning 60 or 70, and all of a sudden your health just falls apart. I can't tell you how many friends that have had to have significant surgery, significant dental work, things that they never even had while they were working and were more fully covered. And now that money, that excess, is even greater because now, of course, your dentists and your doctors are charging more, so that your copay is even higher than it is for a regular employee. So while people talk about it, how much they have to pay out, and I can appreciate that, how much retirees now have to pay out is also significant. Every January, when you get a new brochure, you have to sit down and evaluate it. And often, you don't even really appreciate how much more it's going to cost you until you do something you've done in the past and find out it's costing you significantly more. Just because we've just finished doing taxes, I just looked at the taxes, from our tax records, how much more we paid in medical and dental, and it far surpasses anything we ever paid while he was working, just because we've gotten older. So all those benefits, I shudder to think what would happen if we didn't have those benefits, because even at this point, we can only anticipate that it's going to get more and more.